My apologies. It appears that we've had some technical difficulties, so we're going to go ahead and start over at the beginning. Welcome to today's webinar, Creative Financial Solutions, Thinking Outside the Box. My name is Monica Bryant, and I am the Chief Operating Officer for Triage Cancer. Just a little bit of housekeeping. All callers will be muted for the duration of today's webinar. And if you have any questions or technical problems, please type them in the chat box to the side of your screen. This webinar is being recorded and will be available for viewing on our website, triagecancer.org, at the end of the week. Also, at the end of the webinar, you'll be redirected to a survey. Please take a few moments to fill it out and let us know what you think about today's webinar. We definitely value your feedback. For those of you who don't know, Triage Cancer is a national nonprofit organization that provides education and resources on the entire continuum of cancer survivorship issues to survivors, caregivers, advocates, and healthcare professionals. We host a speakers bureau of experts and survivors available to anybody hosting an educational event. We also host an educational blog, provide online resources, and participate in seminars and webinars and conferences all over the country. And of course, more information about all of these services can be found on our website. So with that out of the way, let's get into the heart of the topic today, finances. So there are many factors that can contribute to a feeling of financial instability after a cancer diagnosis. And that's because there's often changes in somebody's employment status during and after treatment. Perhaps you had to take time off or leave your job entirely to get through treatment and recovery. Maybe you've moved to a part-time position to help make that feasible. Either way, you're likely feeling that change in employment status in your wallet. And it can be next to impossible just to pay your monthly bills, let alone keeping up with all of the extra medical costs. And just because somebody's been diagnosed with cancer doesn't mean that it comes with a pause button. And it's often the case that in addition to your cancer journey, you may have experienced some other life changes, such as finishing up school, starting or ending a relationship, or even moving. And all of these life changes can have an impact on your finances. And of course, the big elephant in the room is dealing with the high cost of treatment, which often means large medical bills or other sort of health insurance issues. Now, we're going to talk a little bit later about having access to good health insurance, but it's really critical because having health insurance can make a huge impact in one's financial health. Now, before we get into addressing how to deal with some of the hits that you may have already felt, I just want to talk a little bit about looking at the big picture of your finances. Because if you don't know what you have and what you owe, you can't make completely educated decisions. So this spreadsheet is something we've created at Triage Cancer to help people figure out their financial big picture. And it will be available on our website for download at the end of the month so that you can use it as sort of a starting point to figuring out what your financial big picture is. Now on the left, what you're looking at, you see items. And some of these things may not apply to you, but we're just giving examples of things you're going to want to include. Do you have a car, bank accounts, retirement accounts? How much are your personal belongings worth? And then you have to look at your liabilities or your debts. So things like car loans, student loans, of course, medical debt would be included here. And once you've put all this information together, you should have a sense of what your net worth is. And again, because at Triage Cancer, we love our spreadsheets as a way to keep things organized, we've also included things for account numbers, login information, contact information, and any notes. This way, all of the information is in one place and easy to keep track of. It can also be a really helpful document if you're ever in a position where you need somebody else, like your financial power of attorney, to step in and help you with things. So again, wait for this end of the month. It should be available on our website for download and all the formulas, so it will calculate the amounts for you. You just kind of have to plug in the information. You know, even if you've had a financial plan prior to your cancer diagnosis, it can be very helpful to review where you are financially after completing treatment. Figuring out what your financial picture looks like can help you decide which of the following steps you should take, if any. It can also help you identify priorities. So maybe your first priority is finding a job. Maybe you're nowhere near that stage because you have to prioritize opening that stack of bills that you've been too afraid to open. Perhaps you're in a place where you're through the deepest part of it and you're ready to start thinking about building your savings or contributing to a retirement plan. So figuring out what your next steps are is going to be entirely personal to your situation. These are just some things to think about. So to get a clear picture of your situation, consider these questions. What's the current status of your finances? And that spreadsheet we just talked about is one way to answer that question. Were you able to keep working through treatment, or did you need to take time off? How did that affect your full financial situation? Now that you're finished with treatment, are you back at work? Were you able to go back to the same job or type of work? Or because of side effects, do you need to look for another career path? And does that involve maybe some additional schooling or licensing that might cost some money? Do you have a stable income? What are your reoccurring and potential expenses? What assets do you have? And again, that's sort of where we talk about that spreadsheet. But we also want to talk about things here like savings bonds and retirement plans, life insurance policies, because some of those assets are things that might be able to help you access cash right now if you need to, which we'll talk about in a few minutes. And then finally, what secured and unsecured debt do you have? Secured debt are going to be things like a car loan or a home mortgage. It is debt that is secured by an item. If you stop paying on that debt, that item gets taken away from you. Unsecured debt are going to be things like student loans, personal loans, and credit card debt, where yes, there are certainly some consequences if you stop paying that debt, which again we'll get into, but you're not going to necessarily lose your home. Now, once you have a sense of the answers to each of these questions, you can then move on to what steps you can take to improve your financial health. Also, as part of figuring out your financial big picture, you must know what your credit looks like. I cannot stress this enough. And there are two things with respect to your credit that you're going to need to look at: your credit score and your credit report. Your credit score is a 3-digit number determined by looking at 5 main categories of your financial history: debts, credits, length of credit history, type of credit used, and your payment history. The score is then used by lenders to predict your financial risk. Now, the most widely used credit score is the FICO score, and FICO scores range from 300 to 850. And the higher the score, the higher your credit rating or credit worthiness is. So as you can see, a score of 800 is going to be in the excellent category. Your FICO score might also differ among the 3 credit bureaus. So the 3 credit bureaus are Equifax, Experian, and TransUnion. And I've given you the contact information here. There are some smaller credit reporting agencies out there that might be accessed, let's say, to access phone service or electric service. But really, the big score that you should kind of narrow in on is your FICO score. But your score is only part of the picture. You may also, or you need to actually, look at your credit report. The items on the report are what helps the bureaus determine what your score is going to be. And it's really important to look at both of these things to make sure that everything on the report is accurate. People are often really surprised to learn that your credit may be checked when you rent an apartment, lease a car, buy a home, or get TV even. Also, some potential employers may conduct background checks that include looking at your report. But fortunately, of all the steps we're going to talk about today, this might be the easiest to take. And that's because each of the 3 national credit bureaus that I talked about are required to provide you with a free copy of your credit report once every 12 months. But you have to ask for it. In order to get a copy of your credit report, visit annualcreditreport.com or call the number I've put up here for you. And once you receive that report, make sure that all the information about you is correct. If not, you can ask the credit bureaus to fix the information. Now, be prepared that you may have to get a fee to get both your report and your score that is permitted. So you can get the report for free, but the report might not include your score for free. You might have to pay for that. That being said, what we've seen a trend recently of a lot of major credit card companies, Discover being one of them, that provide your score for you each month. So you may be able to get all of this information for free. You might just get it in 2 different places. Now, a credit bureau is allowed to report the most accurate negative information for 7 years and bankruptcy information for 10 years. And that is certainly a very long time, but you may be able to use that timing to your advantage. For example, let's say you're trying to buy a new car and need a loan. 6.5 years ago, you negotiated a settlement to close a credit card for less than you actually owe. That settlement will show up negatively on your credit report and will lower your credit score. However, it can only be reported for 7 years. So it might be beneficial for you to wait 6 months before getting the car loan so that item is no longer on your report and you can get a better deal. Of course, this doesn't always work out in the real world. You might need that car now and you can't even wait another 6 months. I certainly recognize that that's the case. My point here is really just to bring up, by understanding how all of this works, you may be able to use this information to your advantage. Now, the Federal Trade Commission is the federal entity that deals with these types of issues and is a great source of information about credit scores and reporting. And their website is just ftc.gov. Now, one last thing I wanted to mention about credit scores. Periodically, FICO releases new versions of its scoring that calculates various types of debt differently. For example, FICO 8 weighs high credit card limits more than a sporadic late payment. The most recent version, FICO 9, which was released in the summer of 2014, made significant changes with the way it looks at medical debt, which of course is fantastic for our community. In previous versions, FICO didn't distinguish between medical debt and other types of unpaid debt. Additionally, previous versions didn't take into account debt paid after it reached collections. FICO 9 now puts less emphasis on unpaid debt due to medical bills as compared with other types of unpaid debt. And once any amounts and collections are paid in full, those are not taken into consideration. So definitely some good news for those of us in the community who have experienced debt due to medical bills. Now, after you've assessed your financial picture, which includes checking your credit score and report, the next step is to create a budget. Now, you've started the process with the financial big picture, but this budget really needs to include any expenses that you might have remaining related to your medical care, as well as your day-to-day expenses. This budget is likely to change more often than the financial big picture. So in my mind, I think the financial big picture probably needs to be updated once a year, whereas a budget might need to be addressed every couple of months. And with the budget, it can be really, really important to project any expenses that you might have related to medical care. And it can be a little bit challenging to do that. But first, we suggest by looking back at old bills to get an idea of how much future care might cost. For example, if you know that part of your follow-up care is going to be an MRI every 6 months, and you've had an MRI in the past, You can look to see how much the MRI cost and how much you had to pay for the MRI to try to project forward. This is certainly not a perfect science, but it is important so that you don't sort of spend a lot of time digging yourself out of debt only to end up back in debt because you didn't think about the future expenses. Now, if you want to create a budget on your own, please just remember you don't have to reinvent the wheel. There are literally thousands, maybe millions, of free templates available online that you can download and customize. There are also some software options like Quicken or even smartphone apps like for your iPhone that are relatively inexpensive that can help you create these budgets. That being said, you might be uncomfortable or overwhelmed with the idea of doing a budget completely on your own. And I completely recognize that sometimes creating a budget is not always as easy as it sounds. And you could be left feeling like this couple. They're sitting at their kitchen table discussing their finances, and the husband says, well, we can pay off our past and save for our future as long as we avoid the present. And I think that we can definitely, most of us can relate to this sentiment at one point. In that case, a financial planner might be the best option for you. Financial planners work with people of all income levels. So don't feel like you have to have Steve Jobs type of money to utilize one. You can visit the National Financial Planning Association to find a planner in your area. And many planners will even provide an initial consultation for free with no commitment. You may also want to consider contacting a consumer credit counseling agency, which can provide you with practical tools such as financial calculators, budget worksheets, and other resources. These credit counseling agencies may also be able to help you negotiate payment plans or settlements with your creditors. But remember, many debt solutions may negatively affect your credit score. Now, this is another one of those personal decisions. Maybe you know that you're not going to be needing credit anytime soon because you have a job you're not leaving, you have a mortgage and a brand new car. So for you, it might be smarter for you financially, to reduce your debt and absorb that 7 to 10 year hit on your credit. Or maybe you've already had a challenging financial picture and you might be less concerned about the drop in your credit score because your credit score is already pretty bad. Well, in that case, maybe you want to work with a debt solution agency, get rid of all of your debt, and start building from now for the future. So this really all goes back to knowing your credit score and what's in your report before you make a decision. But I really urge you to talk through all of this with a professional before you make any big decisions, because especially for young adults, it's pretty challenging to anticipate where you're going to be in life in 7 years. Now, as I alluded to earlier, one of the best ways to deal with medical bills is to avoid them. So to the extent possible, make sure you have adequate health insurance for your situation. Too often I hear from people that they got the cheapest insurance they could because they were trying to save money. But what they didn't necessarily realize is that although the monthly premiums were the cheapest, the plan itself ended up costing them thousands. The Affordable Care Act has made it easier for people to purchase adequate insurance. And for more information on the details of the Affordable Care Act, I definitely suggest you visit the Healthcare Reform Resources page on our website, triagecancer.org. But I do quickly want to talk about why math matters when you're looking at health insurance plans. In the Affordable Care Act's state health insurance marketplaces, there are 4 main levels of plans that you can buy, and they differ based on how much the plan will cover and how much you are responsible for. For example, a bronze plan is one that will cover 60% of your healthcare costs once you hit your deductible, and you're responsible for 40%. The plans there go up by 10%, and the most coverage is the platinum plan, which is going to cover 90%, and then you're responsible for 10% once you hit your deductible. And so again, the math really matters when you're picking a plan. On first glance, it may appear that the bronze plan, which is the one on top, is the cheapest with only a $105 a month deductible. But you have to realize that you have to pay the entire deductible out of pocket before the plan starts picking up the costs. And here, the deductible and the out-of-pocket maximum match, and it's $5,250. So you have to pay that $5,000 out of pocket before the plan even starts picking up 60%. Now, if you're someone who rarely uses a healthcare system, then maybe the bronze plan is a great idea. But my guess is you wouldn't be on this call if you didn't see the doctor with some sort of frequency. Chances are most of you are going to hit the out-of-pocket maximum. So the way to figure out what the plan is actually going to cost you is by multiplying the monthly premium by 12 and then adding the out-of-pocket maximum. By doing the math, here you can see that over the year, the Platinum plan is in fact the most cost-effective for someone who uses the healthcare system by over $2,000. Also, when you're thinking about picking your health insurance policy, making sure that to the extent possible, you pick a plan that has the doctors you see in their network and cover the prescription drugs you take. Thankfully, for many of us who live in states that have their marketplaces run by the federal government, you can get that information right here on their website, which is healthcare.gov. Now, I've given the example from the state marketplaces, but I also recognize that many of us get our health insurance through our employers. The same principle applies if you have two or more plans to choose from through your employer. Do the math the exact same way to figure out which plan is more cost effective. Now, getting the health insurance is only half the battle. The other half is about making the most of the policy you do have. Some quick tips for people to really maximize their policy include using in-network providers whenever possible. And sometimes that's tricky because out-of-network providers may creep in without you even knowing. For example, if you have surgery, the surgeon and the hospital might be in network, but the anesthesiologist might be out-of-network. So it's not always possible to avoid using an out-of-network provider, but you can at least try and request that all the providers be in-network. It's also really important to be vigilant about reviewing your bills. Remember, it's just people who are doing the coding and billing at your doctor's office, and people make mistakes. So check over your bills and make sure you actually received all of the services you were billed for. Lastly, a great way to maximize your policy is to leverage your out-of-pocket maximums. And here's an example of how this all works. Let's say you have a plan that has a $2,000 deductible, and it's an 80-20 plan, which means, of course, you're responsible for paying 20% of your healthcare costs once you hit your deductible. Your out-of-pocket maximum for the plan is $4,000. So if you have a $102,000 hospital bill, what are you actually responsible for paying? First, you pay that $2,000 deductible, leaving $100,000 left. Your coinsurance amount is 20%. 20% of $100,000 is $20,000. But since you have a plan with the $4,000 out-of-pocket maximum, your max, what you have to pay is $4,000. So you pay the $2,000 deductible and $2,000 of the coinsurance, and then you've totaled that out-of-pocket maximum. So what I mean by leveraging this out-of-pocket maximum is if you're in a situation and you've hit your maximum, maybe you want to go get any other medical care you need that year. Do you need other checkups, a surgery? Have you also hit your family out-of-pocket maximum? If so, make sure that everybody gets a checkup this year as opposed to waiting until next year, where you would have to hit your deductible and out-of-pocket max again. If you time it right, you may be able to save a significant amount of money. Now, I am certainly not advocating getting services you don't need or delaying care for this reason. Just simply be aware of how the out-of-pocket maxes work and how you might be able to use it to your family's advantage. Again, it could save thousands. Now, I've focused a lot on the general things that you can do to rebuild your financial health, but I want to spend a few minutes narrowing in on medical bills. These two guys are sitting on a park bench talking, and one says to the other, "My doctor told me to avoid any unnecessary stress, so I didn't open his bill." And while this guy is taking a pretty interesting coping strategy, it's not one that we necessarily recommend. But there are a few things that you can do to reduce the burden of medical bills. Now, I recognize that for all the people on this call, you're in very different situations, and many of you might be post-treatment. But I did just want to share some tips with you about lowering your bills before you receive care, because it might be relevant for follow-up care or any future medical care in general. So you can, in fact, negotiate your hospital bill. Most hospitals have a billing department and even patient navigators that can help you with this. When it comes to getting lab work done, not all labs charge the same amount. Get a list of tests that are going to be performed and shop around for the lowest prices. The same goes for tests that you need. HealthcareBlueBook.com is a site where you can put in your zip code, and it will give you the fair market value of the tests in your area. If you can, try to group your appointments together so that you're only paying one copay. Now, again, this may not always be possible, but you never know until you ask. There may also be times when you can take a generic drug instead of a name brand, which might be less expensive, or even maybe a less expensive course of treatment. I never, ever, ever recommend taking a less effective course of treatment for financial reasons, but you never know what all of your options are if you don't discuss the financial part with your healthcare team. They might just be giving you the option that they're used to giving you. So if you talk to them about your concerns about finances, about the fact that your insurance doesn't cover a particular drug, they might have an equally good alternative that your insurance does cover. Talking about finances is hard, especially with your doctor, where you're already having difficult conversations. But more often than not, we find that the healthcare team is happy to try to accommodate you and doesn't want to put you in a bad financial situation if they can avoid it. So I guess moral of the story is you have to have the conversation. Now, once you've received care, you're probably going to get a ton of correspondence. Just from your health insurance company, you could get 3 different pieces of mail. One saying that they've received a claim, one saying that they're processing a claim, and one called an explanation of benefits, or an EOB. You can usually tell an EOB because it will say in large letters somewhere, "This is not a bill." But this document will give you an idea of just how much you're going to have to pay out of pocket. Now, these EOBs can be a little bit challenging to decipher, and there are a couple of websites that can help you learn how to read it, and I've provided them here. If you have questions about billing codes or the costs of services you've gotten, you should definitely call your insurance company and maybe even your provider so that you can understand this. And then the last piece of information you may get is from your provider directly. And this could be the hospital where you got care, from your doctor's office, or from a lab. And the amount here is what you are going to be responsible for. But don't necessarily take that amount at face value. Also realize that these correspondence may not arrive in this order, which is why it's critical to keep track of the paperwork. For example, I received a bill for my daughter's last checkup for the full amount of the visit. Now, I know that my insurance should cover at least a portion of it, but I haven't yet gotten the EOB, so I wasn't sure how much the insurance was going to cover. So although the bill from my provider's office had a due date that was close to passing, I didn't want to overpay and then try to figure out how to get some money back from the doctor. So I simply called the doctor's office and explained what had happened, and they pushed back the due date and asked me to call them back when I got the EOB. When I got the EOB, it showed that they were going to cover a large portion of the doctor's office. And when I called the doctor's office, they said they would rebill me when they got the check from the insurance company. During this whole process, I made sure to record the times and names of people that I spoke with so I had a record. And it ended up being a few extra steps, but it saved me over $500 in money that I may or may not have ever gotten back from the doctor's office. When we're dealing with medical bills, we strongly, and I mean strongly, recommend reviewing them. Medical bills may keep arriving long after your treatment is over, and it's important to stay diligent and check that your bills are accurate. Dispute them if there are problems, and if you believe that a procedure or treatment should have been covered and it wasn't, know that you have the right to appeal that decision. Most insurance companies have an internal appeals process, and you just have to check your policy or contact your insurance company for more information on that process. Also, thanks to the Affordable Care Act, all states are now required to also have an external appeals process. If you have extensive medical bills, consider talking with a professional bill reviewer or medical claims organization. Each review service is set up a little bit differently. Some will charge you an initial fee, and some will just charge you a percentage of whatever they're able to recover. So I've given some examples here, but please keep in mind that I'm not endorsing any of these services specifically, just giving some examples on how they all work. And while a professional bill reviewer can be really helpful, you should still try to create an organizational system for your bills. These are some that exist already. Cancer 101 or Live Strong Survivorship Notebook are some starting points. But even if you're just stapling all of the EOBs and bills together that are related, that's a great start. This is also an area where if you have friends and family who are asking, what can I do? How can I help? Maybe this is what you do. You hand them your shoebox of paperwork and say, can you just put together in piles and staple all of the related paperwork? It's also really important to keep track of these expenses and mention them to your tax preparer if you have one, because a lot of these expenses related to medical bills are deductible. If you do deduct medical care, keep the records for at least 3 years. I recommend 6 years to be on the safe side, but at a very, very minimum, 3 years in case you're audited by the IRS. Now, if you're in a situation where you have creditors, whether they are hospitals or landlords, try talking with them. We suggest doing this before they turn over your unpaid bills to collection agencies because that can help protect your credit. If you can't make a payment, ask for more time. Check to see if they'd be willing to negotiate a payment plan or accept a lower sum payment. You would be surprised how flexible creditors would be, especially if they know you face a significant hardship like a cancer diagnosis. So the motto here is it can't hurt to try. One word of warning, please be careful if you're considering paying medical bills by credit card. Most of the credit cards have a very high interest rate, and you will likely end up spending much more than is necessary. It's also not recommended that you take out a loan on your home, like a second mortgage or a home equity line of credit, to pay your medical bills, because you're turning unsecured debt into secured debt, and you're now risking losing your home if you can't make those payments. Lastly, as I mentioned, you want to keep track of medical bills, payments, EOBs, pre-authorizations, meals, because they might be deductible. So this is sort of your cheat sheet of what are the things I should keep track of and what can I throw away. I know the paperwork can get quite overwhelming, and this is a little pre-plug for next month's webinar. The webinar is being presented by an amazing woman who is a certified professional organizer, and she's talking all about how to avoid drowning in documents. So more information at the end of this webinar about next month. But These are the things we're talking about because we know the paperwork can get overwhelming. Now, the reality is, even if you do everything right and deal with your medical bills, there often still isn't enough money in the pot for everything. And this is when you may want to think about looking for financial assistance and alternative income options. There are different types of insurance coverage that you may currently have through your employer or that you purchased on your own, which can provide some financial assistance. The first is disability insurance. This is insurance that provides employees with some income while they are unable to work due to a medical condition. There are private, employer, state, and federal disability insurance plans. Keep in mind that each type of insurance has a different definition of disability, and that even if you've completed treatment, you may be experiencing side effects from treatment or have other medical conditions that are keeping you from being able to work. If you have one of these plans, you may be entitled to some retroactive benefits if you're already back at work. There are only 6 U.S. states and territories that have short-term state disability insurance programs: California, Hawaii, New Jersey, New York, Rhode Island, and Puerto Rico. And finally, there are 2 federal long-term disability programs: Social Security Disability and Supplemental Security Income. For more information on all of these programs in depth, we did a webinar in December that is available on our website. But for a quick review, to be eligible for the federal programs, you have to meet the Social Security's definition of disability, which is you cannot do your job, you cannot adjust to a new job, and your disability has or is expected to last for at least 1 year or result in death. Now, with SSDI, individuals work and pay into the system for a minimum amount of time. For most adults, it's going to be 5 of the past 10 years. How much you end up getting out of SSDI is based on how much you've paid in. So someone who has consistently made over $100,000 a year is going to get more out of SSDI than someone who has made about $40,000 a year. There's also a waiting period to get SSDI benefits. Payments are not available until the 6th full month after becoming disabled, but they can be retroactive up to 12 months. And because we're only talking about a way to recoup financial benefits if you are unable to work, there also is a health insurance option after you've been on SSDI for 2 years. And that's the federal health insurance option of Medicare. Now, I mentioned that there is a waiting period for individuals to get SSDI, and here's how that works. Let's say you've applied for SSDI on September 1st of 2015 for a disability that began last January. The benefit check would arrive February of 2016 and would include the first month's payment of February plus the retroactive benefits from January to August. So it includes everything from when the disability began and then to September, and then there's that 5-month waiting period. Now, the other federal program is Supplemental Security Income. And unlike SSDI, SSI is not based on how much you've paid into the system, but rather it's based on having a low income and few resources and falling into one of these 3 categories: being over 65, having blindness, or having a disability. Unlike SSDI, you get SSI benefits the first full month after becoming disabled. And the health insurance option for individuals on SSI is almost always Medicaid. Again, this is a very brief overview of this program. So for more information, I definitely recommend checking out the webinar we did in December. Now, there are some income options for caregivers because we know a lot of people end up taking time off work to act as a caregiver. Unfortunately, there are not nearly enough financial assistance options for caregivers. A few states have paid leave for caregivers, and then some states through the Medicaid program have a in-home support services program that you can apply to. It's called something different in each state, but more information about your state's program can be found on Triage Cancer's website under our state resources. Now, because this webinar was called Thinking Outside the Box, there are some other sources of income for you to think about. Do you have a disability or a supplemental health care policy through your employer or a private policy like AFLAC or MetLife? Some of these plans pay for certain benefits and can provide you with additional sources of income. Even if you've completed treatment, you might be able to get reimbursed for things that you've paid for while in treatment. So contact your insurance company or your employer's human resources representative for more information. Also think about, can you adjust your tax deduction so that you're getting more money up front in each paycheck? Or maybe you're in a situation where you're a terrible saver and you want to adjust it so that you get a bigger lump sum at the end of the year. Think about contacting your mortgage company or credit cards to see if they have a program to suspend your payments for a time because of a disability. Maybe you can use an existing account like a 401k plan as collateral for a loan for cash right now. And then there's some other types of insurance that may be useful in tough financial times, like life insurance. Life insurance is insurance that you can purchase to provide a beneficiary with a set amount of money if you pass away. If you already have a life insurance policy and you need financial assistance, maybe you can contact your life insurance company and see if they have a policy to allow you to borrow money from the policy if you have a disability. Maybe they allow you to stop paying your premiums for a few months if you're unable to work because of a disability. And then there are some companies out there that will provide you with loans using your life insurance as collateral. And then finally, a viatical settlement might be something worth looking into. A viatical settlement is when you sell your life insurance policy to a third party, typically less than the full policy amount. This may or may not be a useful option. I mean, it's great because you can get access to needed funds. However, the downside is that your original beneficiary will not get anything if you pass away. So again, thinking outside the box here to some additional sources of money, not advocating one over the other, and very personal to your individual situation. And then when you're thinking about where to find some additional sources of funding, applying to financial assistance programs might be appropriate. You may be in a situation where the bulk of your cancer treatment is over, but there's still medications you need to help manage side effects or other long-term medical conditions that you experience. There are some local, state, and county community organizations out there. I definitely recommend looking at these, not necessarily for cancer-specific things, but think about what other things could you get assistance with. Maybe there's a county organization that can help you pay your gas bill so that you can take the money you've set aside for your gas bill and help put that towards a credit card bill. There are also cancer-specific and healthcare organizations that may provide financial assistance. Of course, the SAM Fund is a great partner of ours, and they help provide young adult survivors with grants to help transition into their post-treatment life. There are other groups like the American Cancer Society, We Believe Foundation, Hope for Young Adults with Cancer, Cancer Care. I mean, there's so many out there. There are some specific to cancer, like the Pink Fund is specific to breast cancer. So you have to do a little bit of digging. We have some resources on our website, and that page is constantly growing and expanding, so check back frequently. And then don't underestimate the power of love. Your friends, families, neighbors, coworkers could be a source of financial help. They may not realize that just because your treatment has ended, you still need financial assistance. Consider setting up an online fundraiser through a website like Give Forward or GoFundMe to raise money to help pay for medical bills or living expenses while you're getting back on your feet. But I will say, before you set up a fundraiser, please think through the ramifications of making what you're going through public. If you have already disclosed your cancer diagnosis and treatment to the world, then by all means, keep disclosing. But if you haven't disclosed yet and you don't want to disclose, just remember that some of these services could be public, or you have to go in and select the strictest privacy setting to make sure that, for example, your Give Forward campaign isn't searchable by Google. So disclosure is something we talk a lot about at Triage Cancer because we want people to be making educated decisions. And then when you're looking for sources of money, you have to think creatively. So as I mentioned, you might be able to get assistance for utility bills. There are also resources out there to help with transportation, lodging, house cleaning, food, and other necessities. And there's programs that help pay for co-pays, healthcare premiums, deductibles, and other expenses. And then there's a lot of assistance out there to help pay for your prescription drugs. Needy Meds, Patient Access Network Foundation, RX Hope are all groups that can help you figure out some financial assistance for your prescription drugs. There are also programs out there to help with transportation and lodging. So if you're somebody who has to travel to get treatment, think about that. And then the issue of paying for student loans is often really pertinent, especially for young adults, but for a lot of people with cancer. And the good news is that some private student loan companies will allow you to change payment plans or postpone payments through a loan deferment or forbearance process. Federal student loans also have a system for forgiveness if you qualify as having a permanent and total disability or you meet some other criteria. But just keep in mind that any amount of loan forgiveness you may get can be considered income on your federal income taxes. Also, some jobs offer loan repayment plans as part of their benefit package. So if you're in a position to negotiate your benefits package with an employer, this might be a worthwhile thing to consider. So with that, I'm going to skip ahead, and don't worry because there's more information to be found. And the last couple of slides are really just about the nitty-gritty of bankruptcy. And I'm going to suggest that you check out our quick guides on bankruptcy, and we will be holding a webinar specific to bankruptcy later on in the year. So I want to make sure that there's a little bit of time to answer any questions that you might have. And also to highlight our next webinar, which is, as I mentioned, Drowning in Documents. Sarah is a fantastic presenter, and she will give some really practical points on how to deal with all the paperwork that come with a cancer diagnosis. It's on February 17th, same time, same place, and you can register at triagecancer.org/webinars. So with that, I'm going to take questions, and I'm also going to leave up on the screen our contact information so that if for some reason your question is not answered, you can go ahead and shoot us an email or connect with us over social media, and we would be more than happy to try and address your questions. So I'm just going to wait a few more minutes to see if there's any questions coming in the chat box. I'm also going to put up the link to our survey in the chat box, and you will be redirected automatically. But in the event that some of you want to leave early and go ahead and take that survey, we really would appreciate your feedback. Okay, so I'm actually not seeing any questions coming in the chat box. So with that, I'm just going to say thank you so much for joining us today, and I hope that you found it helpful. Please do consider checking out our resources on our website, and we'd love to hear from you either via email or social media about ways that we can improve our webinars and other topics that you'd like to see. So with that, I'm going to say thank you so much, and I hope to see you next month where we're going to be talking about dealing with the paperwork.